Line, please! Get a car! Get a car! Get a car!
The number of nurses leaving the profession in England has hit a record high. According to new analysis, more than 40,000 qualified nurses left NHS employment.
Newton Community Hospital, December 30th. A 20-year-old man of Afghan origin was denied an appointment. Minutes later, 5 nurses and doctors were attacked inside the building. Police say a crowbar was used. The victims survived. This was not a street and not an isolated incident. One of more than 400 violent attacks every week, part of tens of thousands recorded each year since Labour took office. Within 24 hours, 61 emergency zones were downgraded, 5,700 life or death calls were rerouted, and response times in some regions stretched to nearly 3 times the national target. That is the state of Britain's emergency system today, a system that didn't crack, it buckled. For months, ambulance crews have warned that rising violence linked to illegal migration hotspots and neighbourhood flashpoints has turned routine call-outs into high-risk operations. These were not isolated incidents or rare confrontations, but a pattern spreading, hardening and escalating. Now, for the first time, the consequences are happening in plain sight. Across England, paramedic teams began requesting tactical backup for calls that would normally require none, citing threats, harassment and increasingly aggressive crowds surrounding emergency vehicles. Several regions temporarily restricted nighttime deployments after crews reported being followed, blocked or surrounded while trying to reach patients. One internal briefing described the situation in brutally simple terms: we are losing safe access to parts of our own cities. Ministers insist everything is stable. NHS leadership talks about temporary strain, but leaked correspondence from emergency dispatch hubs tells a very different story, one of crews overwhelmed, frightened and openly questioning whether the government has any plan at all. The most alarming shift isn't logistical, it's psychological. When frontline medics begin doubting the safety of the job, when they start asking whether the next 999 call will lead them into a crowd more hostile than the crisis, that is when a country must confront a darker question. If the people trained to save us cannot move freely anymore, what does that mean for the rest of Britain? The breaking point didn't arrive with a dramatic flash. It arrived quietly through scattered 999 calls that suddenly sounded nothing like normal emergencies. The first warning came from Greater Manchester, where a paramedic crew responding to what should have been a routine chest pain call found themselves stalled behind a crowd outside a disputed migrant housing block. Residents argued, shouted, blocked access and refused to move even after sirens were activated. By the time police arrived, the patient was already being moved by neighbours, a risky intervention that should never have been necessary. 2 hours later, a similar pattern emerged in East London, this time involving an intoxicated brawl spilling onto the road. A crew attempting to reach a stabbing victim was hemmed in by bystanders filming, shouting and refusing to clear the path. Seen unsafe, the dispatcher logged, a phrase that should be rare but is now appearing in reports across the country with unsettling frequency. By midday, an internal NHS command dashboard flagged something unprecedented: a nationwide spike in obstructed access incidents, nearly 3 times the weekly average. Crucially, these incidents weren't random. They clustered repeatedly around the same hotspots. Neighbourhoods already strained by migration pressures, overcrowded housing, and ongoing local tensions. Officials refuse to say it publicly, but behind closed doors, senior emergency planners describe it as a breakdown of social boundaries. People no longer step aside when an ambulance arrives. They crowd around, confront, and escalate. Emergency crews, not trained or equipped for street hostility, are the first to absorb the consequences. In Birmingham, a paramedic reported being surrounded by a group who believed he had come to assist the wrong side of an altercation. Body cam footage circulating internally shows him forced back into the ambulance as the crowd pressed forward. In Bradford, a team responding to a mental health emergency was struck by thrown objects while attempting to navigate a congested estate street. They retreated, waited for backup, and the patient deteriorated. During the delay, in Leicester, tensions escalated so quickly during a nighttime call that the crew sheltered inside their ambulance for nearly 12 minutes before police units arrived. What ties these moments together is not violence itself, but the loss of predictability. Emergency work relies on one fundamental assumption, that the public will let you do your job. In neighbourhoods stretched by cultural friction, rising disorder and mistrust of authority, that assumption is eroding. Paramedics are not soldiers, not riot trained, and not meant to make tactical decisions. They are medical specialists who expect the path to the patient to be clear, physically and psychologically. Increasingly, that path is contested, and this is where the real crisis begins. When crews factor personal safety before stepping out of the vehicle, when dispatchers hesitate because they don't know what environment they are sending teams into, when the question shifts from how fast can we save them to can we even get there, that is the moment a national emergency system enters existential danger. The government insists these incidents are isolated, but internal reports show the opposite. This is systemic, accelerating and reshaping how the network functions. One senior dispatcher in the West Midlands put it plainly during an internal call. Half our incidents aren't medical emergencies anymore, they're security risks with medical symptoms attached. Inside London's Emergency Coordination Centre, tension was visible even behind closed shutters. Operators updated risk assessments minute by minute. Routes used for years were suddenly classified as unsafe, and certain neighbourhoods required mandatory police escort. A new phrase entered routine logs: hostile perimeter, historically reserved for riots and terror incidents, now used on weekday evenings. During a multi-agency call yesterday, 2 separate incidents broke out while the meeting was still in progress, both involving ambulance crews prevented from exiting their vehicles. Command staff split into sub-teams to reroute resources in real time. During the same hour, internal dashboards flashed red, not because call volume was unusually high, but because response capacity dropped below safe thresholds. A metric planners avoid discussing publicly because it exposes fragility. Ministers continued to insist the situation was manageable. Inside real-time command logs, nothing looked manageable. In one region, a medic team refused to enter a residential block without police backup after receiving threats from a gathered crowd. Police arrived over 20 minutes later, already stretched across multiple incidents. In another region, an ambulance responding to a stroke call delayed patient movement after someone attempted to force open the rear door. The patient survived barely, and the crew later wrote that they no longer recognise the environment in which they work. Even HS leadership privately acknowledged that the crisis is no longer medical, it is socio-political. Crews are not leaving scenes because of workload, they are leaving because they feel unsafe. A system built on speed, trust and unobstructed access cannot operate when the streets themselves become unstable. A leaked internal briefing circulated late last night warned of compounded degradation, meaning every hour of disruption makes the next worse. One exhausted operations manager after a 16-hour shift summarised it with clarity you will never hear from a podium. We're patching holes faster than we can count them, and sooner or later there won't be enough hands left. This is no longer about delayed ambulances, it is about a country discovering that its emergency system depends on a level of public order that no longer exists everywhere. The government says the system is responding, the people running it say the opposite. Downing Street has no idea how fragile this has become. The blind spot isn't data, it's distance. While medics document scenes they can no longer safely enter, ministers speak in abstractions about capacity management, community engagement and cross-department cooperation. None of those phrases describe the reality of a medic trapped inside an ambulance surrounded by hostility. None explain why some regions have quietly shifted lower priority calls onto volunteers just to keep core services alive. The biggest gap defining this crisis is the refusal to acknowledge the role that overcrowding, unmanaged migration clusters and rising social tension are playing in destabilising frontline response. Privately, senior officials admit the link clearly. Publicly, they pretend it doesn't exist. An internal Home Office analysis warned that environmental volatility linked to unverified arrivals has already begun overwhelming service routes in 5 major cities and recommended rapid reassessment of neighbourhood risk zones and additional protection for emergency workers. None of those recommendations appeared in televised statements. Instead, reassurance was repeated. Britain's emergency infrastructure remains resilient. Inside operations rooms, different words appear far more often: strained, unpredictable, unsustainable. Advisors urged a national address at the height of disruption. Starmer declined, worried that acknowledging the scale would invite questions the government isn't prepared to answer. Why warnings were ignored, why frontline concerns were deprioritised, and why stability is still claimed when those running the system describe hours from structural breach. Westminster is reacting to a crisis it assumed could be managed from spreadsheets, not streets, and that disconnect is now a political liability. One senior to Insider said it bluntly: "This isn't a staffing dispute, it's a public order crisis wearing a medical uniform." Tonight, Britain is left with a question no government statement has answered. If emergency services cannot protect themselves, how are they supposed to protect the rest of the country? Stability doesn't vanish overnight. It erodes slowly through moments like these. And once erosion becomes visible, denial only accelerates the damage.